ngayon pong mas pinalawak pa ang Enhanced Community Quarantine sa NCR Plus. Makibalita tayo mula sa OCTA Research kung nagkaroon nga ba ito ng positibong epekto sa bilang ng COVID-19 sa NCR Plus. Makakausap po natin sina Dr. Guido David at si Professor Butch Ong. Magandang umaga po sa inyo.
Hi, good morning, Yusek Rocky.
Yes, good morning, Yusek.
Advise nyo na lang po ako kung sino po ang maaaring sumagot sa inyo sa mga tanong na ito. Ano po, 1 week of NCR Plus bubble at 1 week po of initial ECQ sa same areas. Nagkaroon po ba ng improvement sa COVID-19 cases dito sa epicentro ng pandemya sa Pilipinas? At ano po yung sinasabi ng pinakahuli ninyong pag-aaral?
Yes, Yusek. Meron talagang positive effect yung ECQ natin, even ng GCQ. Pero nung time ng GCQ bubble, nag-improve by 0.1 yung reproduction number from mga 2 to 1.9 approximately. Pero with the ECQ, nag-improve siya from 1.9 to 1.6. Ibig sabihin yan, yung trend is slowing down. Or if kung ko-compare natin kunyari yung growth rate, 1 week growth rate, nag-decrease siya from 60% increase to 20%. Ang ibig sabihin yan, yung number of new cases natin this week, mga 5,500, it's only a 20% increase from last week. Sa NCR yan, yung 5,500. So nag-i-improve siya, and hopefully with the additional 1 week of ECQ, we can reduce further the reproduction number. Sana mapababa natin to 1 or close to 1. So yun yung gusto natin makita this week with the extension of the ECQ.
Opo. Although nabanggit na nga po ninyo na may significant na pagbaba sa daily cases sa Metro Manila, mataas pa rin po ito kung ikukumpara sa mga nagdaang linggo. Ito po ba ay pwede nang i-consider bilang good news o too early to say pa sa ngayon? Kung sino po ang maaaring sumagot?
Siguro, Yusek, I can answer that, no?
Yeah.
Yung 1 week natin, no Holy Week, no, we hope that the reproduction number would have gone down to around 1.3, no, or 1.4, no. Pero sa ngayon it's just at 1.6. However, having said that, the real effect of the ECQ last week will be felt this week and next week, no. So sa ngayon, I think it is too early to say what will happen by the end of the week, but the trends are going down. It's just too early to say if it's going down enough to approximate a reproduction number of 1.0 or below 1.0. So we are hoping that itong linggo na ito, itong extension ng ECQ ay sana paitingin pa ang implementation. And sa public natin, mag-ano lang ng self-discipline, no? Sa paglabas, sana yung paglabas nila ay essential travel lamang, no? And when they go outside, to practice apat dapat and yung minimum health standard. So again, Yusek, no? I think it's too early for us to say if it is going to warrant a step down or a further extension.
May news, if we're saying it's slowing down, why do we see 11,000 cases?
I think you said 11,000.
Yeah.
Yes, I think Professor Guido can answer it.
Yes, like I mentioned, yung reproduction number is decreasing, or pwede nating isipin yung the increase in cases, new cases, has decreased. Kumbaga, to compare the past weeks, ang increase was 50 to 60% every week. So nadadagdagan ng 50% ng new cases every week. Now, for the past week, the increase was only down to 20%. So yun yung start ng improvement. First, we will see a decrease dun sa upward trend. And then finally, mapupunta tayo sa downward trend. Wala pa tayo sa downward trend. That's why the cases are still increasing, pero the rate of increasing is slowing down. Yun yung sinasabi rin ng reproduction number na nag-decrease to 1.6. So the rate of increase has gone down, pero hindi pa tayo ando sa downward trend.
Opo, kahapon ay sinabi po ng palasyo na posibleng ilagay sa MECQ ang NCR Plus next week matapos po ang 2 linggong ECQ. Ano po, sa palagay po ninyo ba ay sasapat ito para mas bumaba pa sa manageable level ang COVID cases sa NCR? Kung sino po maaring sumagot?
Yusek, I can answer that through a healthcare worker perspective, no? As already seen, the hospitals are full sa NCR, no? Yung it's above 70% ang ICU and isolation bed utilization, no? And we're expecting to see an improvement of the number of cases found in the hospital maybe in a week or two pa, no? And ang punot dulo lang naman is really the healthcare capacity must be able to take care of the cases being brought to them, no? And as we already know from I think 2 days ago, one of the hospitals, in Philippine Orthopedic Hospitals, as a majority of their staff already found positive, I think, no? So nakikita natin na ang healthcare capacity natin ay already at critical levels, and the trend is going down already in NCR, no, but as Professor Guido has said, it has not gone on a downward trend, no. Halos nagpa-plateau pa lang tayo, then later on maybe the end of this week we will see a downward trend. We pray for it, no, but right now I don't see the hospital utilization being eased a bit, no. Konti pa siguro mag-expect pa tayo na medyo nasa critical level pa yung hospital natin, perhaps the middle of this week until the end of this week.
Tanong ni Red Mendoza ng Manila Times for Dr. Guido, tumaas po ba ng slight ang reproduction number natin dahil sa more than 11,000 cases na nire-register natin per day? Are we revising the figures now to expect to go down in the next few weeks dahil sa extended ECQ?
Well, USEC, yes, it did increase slightly. We were on track for mga 1.5 na reproduction number. Pero because of the larger than expected number of cases, the reproduction number halted at 1.6. So in terms of the number of yung projection natin, we're still expecting around the same, which means we'll still be having mga 11 to 12,000 cases per day for the next week or so until we see a downward trend. So bago natin makita yung downward trend, ganun pa rin, matataas pa rin yung numbers na makikita natin.
Opo. Tanong pa rin po ni Red Mendoza ng Manila Times para po kay Professor Butch Ong. Right now daw po nakakalungkot isipin na maaari pang magtagal yung kalbaryo ng mga hospital. So dapat na po bang ikonsidera ang home treatment bilang option sa COVID?
Well, Yusek, nakikita natin ngayon na ini-increase na ng gobyerno, especially in the local government level, ang capacity ng isolation facilities, no? So some of the LGUs have already spoken to the public school system, I think, to use yata their facility for quarantine, no? So nakikita natin nag-i-improve naman, and doon pwede natin mai-refer yung mga mild cases, no? Now, with regards to the moderate to severe, no, yung mga doktor po natin, no, they're really working around the clock para lang ma-turn over, no? So mas mabilis yung pag-recover para mag-turn over ng mga panibagong mga available beds for the incoming patients. So tama yan, no? Nakakalungkot nga isipin na baka tumagal pa ang yung kalbaryo, ika nga, ng ating mga healthcare workers. But there are actually things done now to improve the capacities, no, especially in the level of the quarantine facilities, no. So yung mga doktor po natin, no, hindi po nadadagdagan yan, no, although just recently, no, yung physician licensure board examination ay katatapos lamang at maraming bagong doktor ang Pilipinas ngayon, no. Pero yung mga specialista on COVID, mga infectious disease experts, yung mga intensivists, yung mga nasa ICU, no, sila po ay hindi nadadagdagan, no. And ang kaya ang amungkahi namin sa publiko ay to stay home and just to go out when it's only needed. Kasi hindi na talaga baka kayanin pa ng healthcare capacity kapag kayo ay nagkasakit at napunta sa moderate to severe level of COVID-19.
Po kay Professor Guido, may tanong po si Joseph Morong ng GMA News. With this current trend of decrease, what's the reproduction before ECQ ends on the 12th? And with the current reproduction rate and under the ECQ, we will reach 1 million cases before April?
Yes, yung reproduction number, we will have to see how fast it decreases. Pero right now, ang trajectory is we're seeing maybe 1.3 or 1.2 by the end of this coming week. So we're hoping it will improve much better than that. May indicators naman that it may decrease faster than that. Pero yan yung medyo conservative estimate from 1.2 to 1.3. And yung 1 million total cases, that will be breached before the end of April based on the projections that we're seeing.
Ito pong tanong ni Joan Nano ng UNTV, mukhang para po sa inyong dalawa ito. Ano daw po ang assessment ng OCTA sa ginagawang COVID-19 vaccination program ng government? And can we say that we are on track or are we hitting our target? O masyado daw pong delay ang vaccination natin at kakaunti pa rin ang bilang ng mga nababakunahan?
Siguro, Yusek, I can answer that first, no? Yung vaccination program natin must be able to reach 70% of our population to achieve herd immunity. Sa ngayon, karamihan sa mga healthcare workers already, lalo na sa NCR, have received their first dose. And some have already completed the second dose. And now we are seeing already that the next in line, no, yung mga senior citizens and those with comorbidities are now being vaccinated. No? So it's still too early, I believe, to make a trend line or a possible projection on how it will affect the decrease or of COVID-19 trends sa atin, no? But yung pag-roll out naman, no, nagagawa naman sa mga vaccination centers, no. Nakita ko naman personally din yung when I had my first dose, no, karamihan naman talaga yung mga healthcare workers na frontliners are already given the first and second doses. Yung question na lang really is regarding the stocks that we have, no, the supplies that we have to roll out, number one, para ma-roll out yung mga susunod na mga levels, no? So we have the PWDs, we have the senior citizens, we have those who have comorbidities, and give the second dose, no? Para sa mga healthcare workers na wala pang second dose. So I think the next challenge will be on the supply system natin, no, kung gaano kabilis pumasok yung mga bagong vaccines na para sa susunod na tier na mga tatanggap ng bakuna.
Opo, Dr. Guido.
And to add to that, Yusek, so yung ginagawa ng government, focus on testing and contact tracing and isolation. Yes, yun yung dapat tutukan, but we'd also like to suggest na since maraming healthcare workers ang nagkakasakit ngayon or they are exposed, we hope that the national government can provide some form of quarantine or isolation facility for healthcare workers, and I think we did that last year. Siguro we can reassign or designate some hotels or motels for this purpose para mas madali silang so they can be isolated and they can be protected din, and we can protect others because of the possible exposure ng mga healthcare workers.
Opo, Dr. Guido, may pahabol si Joseph Morong sa inyo. No po, by April 11, if we have 1 million cases, kaya daw po ba ng hospital natin?
Yusek, we to Joseph, we didn't mean na aabutin natin yung 1 million cases by April 11, and we're expecting that by the end of April. Yung hospitals, as long as yung increase ng new cases is controlled, baka naman kayanin. We've seen that some hospitals have scaled up their capacities, although yes, admittedly, medyo puno na yung mga hospitals. We hope na maybe they could add more beds and transfer some healthcare workers from the provinces to NCR, because we really have a critical situation right now sa hospitals natin.
Okay, maraming salamat po sa pagpapaunlak sa inyo, Dr. Guido David at kay Professor Butch Ong mula po sa OCTA Research Group. Mabuhay po kayong dalawa. Salamat po sa inyo.
Maraming salamat po at magandang umaga.